Do this. Okay. All right. So hello, everybody. And thank you so much for having me today for your Coast to Coast seminar at the end of April here. My name is Julia Daun, and I'm really excited to share with you on the latest evidence we have for exercise in prostate cancer and a number of resources to help you become more active or continue being active and really start to think about what activity looks like in your life and across the prostate cancer continuum. I'll tell you a little bit more about both myself and Dr. Nicole Quilos-Reid, but first I would like to start by acknowledging that we live and work within the traditional territories of the First Nations people of Canada. We recognize that the land as an act of reconciliation and gratitude to those whose territory we reside on or are visiting, and acknowledge the many First Nations and Métis who have lived in and cared for these lands for generations. I've been very lucky and privileged to work here in Calgary, Alberta, on the Tsuut'ina Nations over the last 11 years, and that's where I'm presenting from today. I would also like to acknowledge that in our health and wellness lab, we champion equity, diversity, inclusion, and accessibility within our team members, our research questions, the training we provide to staff and volunteers, our programming that we develop and deliver, and the resources that we continue to implement into community-based settings. Today, we'll spend our time, I know we've got a good chunk of time together, and we'll spend it talking a little bit about some of the background information on exercise and prostate cancer, the latest exercise evidence and what we know across the entire cancer continuum and some specifics in prostate cancer, and then really spending a lot of time on a roadmap on how to become more active. So we'll talk about the cancer and exercise guidelines, the exercise oncology resources that we have offered across Canada, and then some tips and tricks for how to understand your behavior change and how to set goals and make goals that are realistic and help them stick. Then I have a few summary points, and then I understand we've got some time for questions and answers at the very end. I know we're saving Q&A to the very end, but please feel free at any point to jump in with any questions you may have or points you may have. I will have some reflective questions as we move along, so please feel free to interact in whatever way feels best for you. On that note, you might already have this nearby, but if you don't, I encourage you to grab a pen and a notebook or your computer, something to write notes on. You can also just sit back and listen and enjoy. When we get to the part where we talk about goal setting and some of those strategies for behavior change, I'll be prompting some reflections and questions. So if that's something that's interesting to you, go and grab a pen or pencil and notebook so you can follow along. So a little bit about us. My name is Julia Daun. As we were just talking about with Natasha, I'm at the very tail end of my PhD. I actually just defended a couple weeks ago, and I'm submitting everything tomorrow. And my PhD is in the area of exercise oncology. I've worked a lot with prostate cancer and a number of tumor groups over the last 11 plus years. And my passion doesn't only lie in the science and the evidence for exercise across the cancer continuum, but also in the psychology of exercise and the psychology of behavior change, and how we can support people to see themselves as movers and actually adhere and engage with exercise to obtain the benefits. I've learned all of this under Dr. Nicole Quilos-Reid's mentorship. Dr. Nicole Quilos-Reid is a leader and leading expert in exercise oncology and behavior change. Internationally, she's known all over the globe for her work, and everything that I present on today really is under her framework and the work that she's built here, not only in Alberta, but across Canada. Beyond the two of us, we work within a large lab. It's called the Health and Wellness Lab in Calgary, Alberta, and it's comprised of amazing individuals who are passionate about making exercise part of standard cancer care. We've got exercise professionals who work with us, researchers, students and trainees, a number of volunteers who volunteer their time to help develop and deliver exercise programming, and healthcare providers, so oncologists, nurses, psychosocial oncologists, people who are passionate about exercise and working with us to see how we can develop, deliver, and evaluate safe and effective programming. So that's the team that's behind us. I know it's just my face you see here today, but all this work that's led by Dr. Quilos-Reid is supported and built and brought to fruition by this amazing group of people that we have. Okay, so some background. I know everyone who's on the call here today probably is very aware of some of these statistics and some of the information I'll share, and you probably know a little bit more about it than I do, but I always find it helpful to provide a bit of background information before jumping into some of the evidence. And so in Canada, we know that prostate cancer is the most common cancer affecting Canadian men. It's estimated that 1 in 8 will be diagnosed in their lifetime. Our 5-year survival rate for prostate cancer is quite high at about 91%, and the advancements and treatments have really improved and increased these survival rates. So improvements in detection, early detection and screening, surgical procedures, chemo, radiation, and those multimodal treatment approaches have really improved these survival rates and improved the outcomes, those survival outcomes of individuals diagnosed with prostate cancer. But we also know that these treatments can be associated with a number of negative treatment-related side effects. These could include things like urinary incontinence, erectile dysfunction, fatigue, overall decrease in activity and physical function and independence, changes to body composition, so our muscle mass, our bone mass, and decreased overall quality of life, mental health, emotional well-being, social well-being, the things that make people feel like themselves and feel like they can be well in life. The good news is that exercise, activity, and movement are evidence-based interventions for enhancing the wellness of individuals living with and beyond cancer, including those with prostate cancer. And prostate cancer is actually one of our most evidence-based or evidenced tumor groups when it comes to exercise. Given that it's the most common tumor type across Canadian men, there's a lot of researchers who have devoted time to better understanding the role of exercise across the prostate cancer continuum. And within that, across all tumor groups, the field of exercise oncology has really grown over the last several decades. It's been around for years, and we have over 10,000 published studies on the topic and over 3,000 randomized controlled trials. When we look at exercise trials or interventions, that's our highest level of evidence that we have, and there's been over 3,000 of them. So there's researchers, there's people who are really keen on studying exercise and physical activity. And you might hear me use both terms as well as the term movement. And I just want to spend a couple moments clarifying what the differences are. You might hear me use them interchangeably. Exercise is your structured and planned movement. So this is typically associated with when you make a plan to go to the gym or go for a walk or go for a swim. You typically schedule it, you plan it, and it's often associated with a typical goal or something that you're hoping to achieve. Physical activity is more broad. You can kind of think of it as your umbrella term. That is simply unstructured movement. So it's you moving your body, anything that increases energy expenditure. So you're moving your body and you increase your energy expenditure. A nice example of this is if you're going to the grocery store, you park a little further away from the door to get your extra steps in, your incidental movement that happens in an unstructured manner. All movement, whether it's structured, unstructured, planned, or incidental, is beneficial. And you'll hear me talk a lot about guidelines and some of the specifics around types of movement, but know if there's one thing that you take from this presentation today, is that movement, regardless of how you do it, is beneficial. It has a cumulative effect, and there's multiple ways to do it. It's not a one-size-fits-all approach. So in terms of the exercise oncology evidence, research that has looked at both structured, unstructured exercise is very robust. This is a field that's existed for years, and we have, again, 10,000 articles and studies that have been devoted to this topic. And all of this research has led us to the conclusions that exercise is both safe and beneficial across any stage of the cancer experience or continuum. So from pre-treatment to treatment, so when someone's undergoing chemotherapy, radiation, or surgery, to post-treatment when you're in that acute recovery phase, into survivorship or advanced cancer care, we know that exercise is safe, effective, and beneficial across all these stages of care. And I'll walk you through some of the evidence on this specifically. Some of the strongest evidence exists for outcomes like anxiety and depression, fatigue, that's our #1 most reported or most common side effect from cancer, quality of life, which encompasses a number of different domains related to our wellness, physical function, so our ability to to carry out activities of daily living, have the baseline fitness to do the things that we love to do, and lymphedema, or swelling that can sometimes happen in our body after certain treatments. So that's where our strongest evidence lies when it comes to exercise oncology. And what I mean by that is that these are some of the outcomes that have been the most studied and have the highest quality trials or studies that have looked at these outcomes. So that's where we see the strongest evidence. We also have moderate or really good evidence for sleep and cognitive and bone health, and sleep. So bone health associated with body composition and sleep. We know that that can be a big side effect and a big challenge for a lot of people living with and beyond cancer. Some of our outcomes that we've started to see some evidence on, but it's not as strong or not as well studied as some of those other ones, include cognitive function, cardiotoxicity that often happens after certain treatments like chemotherapy, fall prevention, nausea, pain. Pain is starting to be studied a little bit more, which is exciting, and chemotherapy-induced peripheral neuropathy. Now, that's not to say that some of these outcomes don't have benefit and that we don't see evidence. It just means that we have stronger evidence for some of those first outcomes that I talked about, and these are still being researched, and we need a little bit more information to know exactly the dose and the types of exercise that might be associated with improvements in such outcomes. I want to highlight just one of these outcomes. As I mentioned, cancer-related fatigue is our #1 most reported side effect across any individual living with and beyond cancer. And fatigue is often associated with this vicious cycle that you see on the screen here. So when someone is fatigued, that often is linked or leads to more sedentary behavior. So people are less active when they're tired. That then leads to deconditioning. When we are deconditioned, we're not moving our body, we're not using our muscles, and that leads to muscle atrophy, or our muscles become weaker, our body becomes weaker. That in turn makes us more fatigued, leads to more sedentary behavior, and then you end up in this vicious cycle where you're fatigued and decreasing your function, and you're not seeing improvements in an energy or in your fatigue and just overall wellness. But the good news is that this is a very strongly studied outcome, and we have a number of studies that have showed that physical activity can improve these feelings of fatigue. And the key is knowing when to deliver movement, how much to deliver movement, and making sure that it's done in a way that feels good for the participant. This particular study here looked at fatigue in individuals with who are receiving stem cell transplant, and it was a review of randomized control trials, and they found really promising findings for improving fatigue with a physical activity and exercise. There's also a lot of evidence for survival. This work here by Friedenreich and colleagues in 2019 looked at pre-diagnosis physical activity and post-diagnosis physical activity, and what that looked like with for survival outcomes. And the take-home message was that those who had higher pre-diagnosis and post-diagnosis levels of physical activity were associated with improved survival outcomes for at least 11 cancer types, one of which was prostate cancer. So we know that physical activity is important across all stages of the cancer continuum, but this really speaks to that pre-treatment phase of the cancer continuum, and knowing that if we're active, even prior to that diagnosis, we can see improvements in survival, in addition to outcomes like physical function, anxiety, and depression. Here's another bit of information on survival, specifically looking at the dose. So how much exercise do we need to see these improvements in survival outcomes? Right now, the evidence is saying that somewhere between 90 minutes to 3 hours per week of moderate to vigorous activity is associated with significantly reduced risk of your cancer recurrence or your cancer coming back, significantly reduced risk of cancer mortality, and significantly reduced risk of all-cause mortality. So death by cancer or death by any cause. So as little as 90 minutes a week. So 3 times a week at 30 minutes, or you can accumulate in bouts of 10 minutes if that works better for you. We can see these significant improvements in survival. One more study that I'll highlight for you here. This is a systematic review of exercise systematic reviews that was done by Stout and colleagues in 2017. This is the highest level of evidence that we can get when it comes to research. This is a study that compiled all the information they could find from other studies that did the same thing. So a systematic review finds all the studies that are related on a certain topic or answer a specific research question and synthesize that knowledge, those findings into one paper. And what this paper did was they did that for every review they could find on exercise between 2005 and 2017. There were 51 reviews included on the topic, and the overall conclusions were that, like we'd already talked about, exercise is safe and beneficial across all stages of the continuum. We're seeing that moderate to vigorous intensity seems to be the most beneficial, and I'll talk a little bit more about what that means in a few slides. They also looked at the different stages of the cancer continuum and how to prescribe exercise to encourage the best benefits during the different times. During treatment, the goals of exercise are often to help manage treatment-related side effects, prevent further decline, maintain where someone is. And then after exercise, we're typically moving towards improving function and starting to increase maybe our intensity and duration of exercise. This review also found that exercise, when it was done in a structured format, yielded better results when it was supervised. So in a supervised setting with an exercise professional or physiologist who's guiding participants through the exercise, and serious adverse events were uncommon, pointing to the safety of exercise. Taking a little bit of a closer look at the prostate cancer evidence, a lot of which has already been summarized in the prior slides for you here. But in this work by Anderson and colleagues, they found that exercise for those living with prostate cancer have additional metabolic benefits. So body composition, we already looked at that, but we know this can be a really big one in prostate cancer, depending on the types of treatments that people might be undergoing. And they specifically found improvements in lean muscle mass, which we know is important for a number of our bodily functions. We also saw improvements in lower body strength and aerobic fitness. So overall function, lower body strength, or how strong our legs are, and our glutes or our buttocks muscles are, is directly linked to functional independence into older age. And aerobic fitness, or your heart health, is also directly linked to independence and wellness into as we move or progress into older age. We also saw improvements in mental health and blood pressure. So improvements in those vital signs and those basic health domains and health components. Now, we have all of this evidence, thousands and thousands of studies to point to the evidence or the benefits of exercise across the cancer continuum. Most of us at this point of our lives know that movement is beneficial, but very few individuals living with and beyond cancer are actually active. We see that there's only about 10% who are active during treatment and only between 20 and 30% after treatment. And when it comes to the guidelines specifically, only 17 to 43% are meeting the exercise-specific guidelines. So this makes us think, what do we need to do to support people to be more active? We have this evidence, we have the knowledge, research has been done. What do we need to do to actually support people to see themselves as movers and bring wellness into their life? And so the bulk part of this presentation today will be talking about exactly that, a roadmap to becoming more active. Whether you are already meeting guidelines, whether you are just starting your exercise journey, I have some tips and tricks and resources for how we can actually take that evidence, take the knowledge, and put it into practice in our lives. So the first step is knowing the cancer and exercise guidelines. So before I present on this, I encourage you to just take a second, write it down. What are you or just think about it. What are you currently doing to move your body? So we'll talk about these specifics in a moment, but what do you do throughout the week or throughout your day to move your body? Whether it's going for a walk, whether it is going to a gym or a class, maybe it's gardening. I know we're getting into nicer weather. Maybe it's swimming, whatever it looks like. Take a second to just reflect upon what you're already doing in your life to be active. I'll give you a couple moments. And I promise there's no right or wrong. This is just a reflection for yourself. Give about 10 more seconds here. Okay. You locked in your answer. So we're going to talk now about the cancer and exercise guidelines, and you just reflected upon what you're already doing for a physical activity. When I show you these guidelines, it'll be helpful to know kind of where you're at and what your starting point is. Now, the guidelines, we call them guidelines for a reason. They're based on expert consensus review of the literature to know how much exercise, what type of exercise, and what modality to move our bodies to get those best benefits that we saw on those slides earlier. And we've got a number of guidelines, position statements that have been put out by different organizations around the world. We have our American College of Sports Medicine guidelines for exercise and cancer. We've got the Australian position statement on exercise as medicine in cancer management. And then there's also the American Cancer Society Nutrition and Physical Activity guidelines in cancer care. The ones that we follow here in Alberta and across Canada in our work are the ACSM, or the American College of Sports Medicine guidelines for individuals living with and beyond cancer. And this is what they are. The first guideline, or the first part of the guideline, is all about aerobic exercise, or the movement that we do to increase our heart rate, get our blood flowing. We know that our heart is a big muscle in our body. It's just as important as other muscles. Aerobic or cardio exercise gets our heart muscle working and pumping blood to our other to the other parts of our body. So this could be activities like walking, swimming, biking, jogging, dancing, wheelchair sports, seated dance parties, anything you can think of that gets your heart rate working a little bit. The guideline is 90 minutes of moderate to vigorous intensity per week. I know you see a lot of details here on intensity. I'm going to tell you more about that in the coming slides, but the key take home here is 90 minutes of moderate aerobic intensity per week. This can be done in bouts of 10 or more minutes, or you could do larger chunks of time, whatever works for you, but the guideline is around 90 minutes. Now, comparing this to the general population, or those who aren't living with a cancer diagnosis, the guidelines are 150 minutes. And for years, the guidelines for cancer were the same, 150 minutes of aerobic exercise per week. And after that synthesis of knowledge and the expert consensus that we talked about before, we found that actually we can get those same benefits with even less exercise. And that's why right now we're sitting at about that 90 minutes of cardio or aerobic exercise per week. Strength training, 2 days of the week. So this is when we are using our muscles, strengthening our muscles, working against gravity to strengthen our bones, our muscles. This can be things like your weight training, your body weight training. This can be working with resistance bands. I often say cans of chickpeas or water bottles, whatever you have at home, anything that allows you to work against gravity and strengthen those muscles and your bones. The guidelines here are trying to do this twice per week involving your major muscle groups. And then in prostate cancer specifically, there's also guidelines for pelvic floor exercises as recommended and as needed by a physiotherapist, in addition to these strength guidelines. Some examples of strength exercises are standing on one leg, getting up and down from your couch. It doesn't have to be very complex to count, anything that gets your muscles working. And then the last part of the guidelines is flexibility or mobility training on most days of the week. So this type of training is really important to keep our joints mobile. It can help prevent injury. It can also help improve your strength. And then strength can also help improve your flexibility. So it's kind of a two-way street. But this is things like your yoga, your stretching, your deep breathing and rolling your shoulders at the same time. Anything that allows you to kind of move through your joints, keep yourself moving, would be your flexibility training. And we say most days of the week because, again, this doesn't have to be something that's structured and planned. Any kind of moment that you have to just move your body, keep things moving, is our flexibility goals. So these are the guidelines of aerobic strength and flexibility training, 3 different types of movements that people are encouraged to incorporate into their day, into their week, as many days as possible. Now, in terms of intensity, I know I promised I would come back to this for all of you. Intensity, when I said moderate to vigorous, an easy way to think about it, and you can measure it with different things like your heart rate. You can manually take your heart rate. If you have an activity tracker, you can look at your heart rate. But a really easy way to look at it is a scale of 0 to 10. We call it our rating of perceived effort or exertion scale. So this scale goes from 0 to 10, where 0 is no effort at all. Kind of like if we're all sitting here right now, or you're watching your favorite TV show, you're not really exerting energy. You could do this all day long. 10, is the absolute hardest exercise you could ever imagine. It's very, very hard. It's absolutely maximal. you could not stay at a 10 for very much time. The guidelines for cancer and exercise are somewhere between that 2 and that 6, moderate to vigorous or hard. 3 out of 10 is you're starting to feel like you're exerting yourself a little bit. It's not especially hard. You have no problem continuing. You could do that for a while, but you're feeling like you're starting to exert yourself a little bit. When you start getting to that 4 to 6 region, this is like if you're late for an appointment and you're walking really fast to try to get there. Maybe you're starting to sweat. Maybe you're starting to feel like it's hard, but you could still continue for a while. So 3 to 6 tends to be that sweet spot for the benefits that we see in cancer and exercise. We talked earlier about fatigue a little bit. We know that people who are fatigued, typically we like to keep them a little bit lighter, maybe around a 2 or a 3. We know that if we're tired or we're really fatigued, it's better to get a little bit of movement in lighter intensity so that we feel better after versus going too hard and feeling even more fatigued afterwards. So really this guide is just a way for you to articulate and think about how hard you feel like you're working. It's subjective. It's different from person to person. But for the most part, we see the most evidence between that 3 to 6 out of 10 range. So that's our intensity. Overall, the guidelines when it comes to the different time points across the treatment continuum or the cancer continuum, we know, again, exercise is safe and feasible during treatment. There used to be a lot of people worried that exercise might undermine treatment efficacy, and we actually see the opposite. We know that if we are exercising during treatment, we can maybe even improve some of that exercise tolerance. There's researchers in Australia who for years have been looking at exercise administered during chemotherapy. So while someone is actively receiving their chemotherapy in hospital, we know that this can improve function, fatigue, and quality of life during treatment. And the key, even if we're not getting, oh, I feel like I'm drawing something on the slides here. Even if we're not getting in that structured exercise, the goal is to avoid inactivity as much as possible and return to activities of daily living as soon as we can after diagnosis. After treatment, the goals of exercise change a little bit, where we're focusing now on building back our fitness, recovering from the treatment, and we're improving that overall function by adding maybe more time, more intensity into our routine. And across all of this, like I said, the guidelines are a starting point. We need to individualize and tailor exercise as much as possible based on where you're starting, your age, your sex, your type of disease or your type of cancer that you have, the access to social support that you might have, the programs and considerations of barriers. And we're going to have a lot of slides where we talk about exactly this last part is that individualization and how we can do that from person to person. Overall, when we look at the exercise evidence, we know that there's benefits physically, psychosocially. We know there's survival benefits as well. Exercise does not undermine treatment efficacy. There's no negative impacts when we administer it safely by exercise professionals who have specific training in cancer. We know that it can improve outcomes instead of add or worsen outcomes. And then there's differences in how we prescribe and motivate exercise based on where someone is in their cancer trajectory. So more maintenance and preventing less decline than normal during treatment and working on improvements or adding after treatments, again, based on each person's needs. The main message of all of this is to simply move more. We have benefits or we have exercise evidence that look at structured exercise, but we know simply being active is really important. One limitation or challenge with these guidelines is you could have someone who's the weekend warrior, right? Like you do a big hike, big workout, Saturday, Sunday, you meet your guidelines, your aerobic and your strength guidelines on those 2 days. And if you're sedentary the rest of the week, it's not that it undermines or takes away the benefits you might receive from the big weekend workout that you did. But what the research and the evidence is pointing to is that it's good to do a little bit over time. So a little bit Monday, a little bit Tuesday, a little bit Wednesday. It's better to be consistent, a little bit of activity every day than just everything on one day and nothing the rest of the week. So simply moving your body, whether it's structured, unstructured, as much as you can. And so I was thinking we could try some of this together right now. So if you're up to it, I invite you to sit up nice and tall in your chair or wherever you are. If you just want to sit back and listen, that's okay too. And we're going to start just rolling out our shoulders. Maybe as your shoulders come to your ears, maybe take a nice big breath as you exhale. Maybe you drop the shoulders back. Awesome. This is a good one. You can do this anywhere when you're waiting for your appointment, when you're watching your favorite show. Okay, awesome. Now, if it feels good, maybe we take our arms side to side, left to right. Beautiful. Or maybe if it feels better, maybe you just move your body side to side, whatever feels good for you. Okay, we're going to have a little bit of fun now. I'm going to move my chair so we have a bit more space. If you're feeling up to it, maybe we go from sitting to standing a couple times. So sitting to standing, if it doesn't feel as good to do that, you can stay seated, do some leg extensions. So kick one leg out in front and then the other. So whatever feels good. Exhaling, we come up. Inhaling, we go back down. Beautiful. Good job, team. Excellent. Let's do 3 more as a group. I know I've got my video blur on. Hopefully you can still see me okay. Okay, now hold on to something like your chair, a wall. Maybe you have someone with you at home, and let's just try standing on one leg. Standing on one leg, holding onto something for support. If that feels like too much today, you can place your feet side by side and just practice a side by side. I wonder if I can unblur my background here for these couple exercises here. Let's unblur that. Beautiful. Okay, let's hold 10 seconds on one leg. 8, 7, 6, 5, 4, 3, 2, 1. Let's switch to the other leg now. Let's hold 10 seconds here. 10, 9, 8, 7, 6. Good job, team. 4, 3, 2, 1. Okay, and let's finish it off with either a march or a little jog on the spot. 30 seconds of walking, or you can stay seated, march in your chair. Just 10 seconds here, get our blood pumping a little bit. Let's go 8, 7, 6, 5, 4, 3, 2, 1. Done. You did it. Awesome job. Take a seat back down, or if it feels good, you can keep moving. But my friends, that is as simple as it needs to be. It doesn't have to be fancy. You don't have to go to the gym. Movement can be from your home, from your workplace. And we did 3 minutes of movement together, maybe more like 2 minutes. And we addressed all those different components of our guidelines. We got a little strength, little balance, little aerobic, little flexibility. And that's as simple as movement can be. It doesn't have to be anything fancy. And so I encourage you to think about what you love to do for movement. I know you wrote down earlier what you were already doing. You can think about what that looks like in relation to the guidelines. But a key takeaway is it doesn't have to be the guidelines right away. You might already be meeting those guidelines, which is great. Maybe you have a goal to maintain how much exercise you're doing, or maybe you want to add to what you have for guidelines. Maybe right now you're not getting as many activity minutes, and that's okay. Maybe you start by adding 5 minutes in per week, or 2 minutes in per day, or 20 minutes per week, whatever resonates most with you. Think about what you're doing right now. And I encourage you to think about what you love to do for movement. It doesn't have to be going to the gym. It could be, maybe you love lifting weights. Maybe you love to kayak or snowshoe. Maybe it's having a dance party with your partner or your grandkids. Maybe it is walking around. Maybe it's cycling, adaptive cycling. I see here someone's sharing in the chat that they have a home workout app on their phone that they've been using 3 to 5 times per week for 3 years. That is awesome. Thank you so much for sharing that. And we'll talk a lot about different strategies and behavior change techniques that you can tap into to help add your movement in. But it's about finding what works for you. And your preferences can change, and it's different for everyone. It doesn't have to be what I do. Could be different from Natasha, could be different from Ross, from Bob. We all can have different movement patterns. And again, the guidelines aren't necessarily a starting point. It might be, or it might be a goal that you work towards those guidelines over time. Think about where you're at now, what you love to do, and what might be feasible. And we'll talk about behavior change strategies and techniques in a little bit as well. Here are just some ideas for how you can make your day more active. If maybe you are meeting the guidelines, but want to implement a few more exercise snacks throughout the day, or if maybe your activity Maybe you're working on just starting out, adding more activity into your day. Some ideas that I often share and what we share within all of our programs are things like practicing balance while you wait for your coffee or tea to brew in the morning. So standing on one leg like we just did, or a tandem stance where both your feet are together. Two sit-to stands when you're watching TV or going to the bathroom. There is a researcher who years ago, he was researching, I forget his name, but he was looking at how do we make exercise a habit? If we link exercise or movement to something we do every day, like brushing our teeth or going to the bathroom, maybe we'll be more likely to perform and engage in that movement. And so he did a self-study on himself where every time he went to the bathroom, he did 2 sit-to stands like we just did together. Not 3, because then it becomes too much to think about and to do, but 2 seems feasible. And after 6 months, he found that it became a habit. He didn't even think about it. Every time he went to the bathroom, he would do 2 sit-to-stands. And he actually noticed a difference in the musculature of his legs. They looked stronger over time. So there's an idea next time you go to the bathroom. Parking further away from the grocery store, taking the stairs if those are available options to you, setting movement alarms. So if you know that your goal is to add more movement in, and sometimes you just simply forget, the day gets ahead of you, adding a reminder on your phone where your alarm can go off once or twice a day or once an hour, whatever works for you. Having a dance party. So make it fun. Think about what is fun for you. Putting on your favorite song, grabbing your people and just having a dance party in your kitchen or seated at your dining table. Sitting down right now together, you could tap your heels or tap your toes, get blood flow moving through your legs just right here by sitting. That adds up too. And so thinking about these exercise snacks or little bouts of movement that you can add throughout your day, that add up. The one thing we know about movement and exercise is that it has a cumulative effect. A little bit here, a little bit there, it all adds up. There's this all or nothing principle that is very common in the health and fitness world where people, where it's very common for us to feel, oh, you know what? I wasn't able to get in my workout today. 30 minutes feels like too much. I'm just not going to work out at all. I'm going to try again tomorrow. And while that, maybe the next day works better, and maybe that was a really high symptom burden kind of day, it's absolutely important to listen to your body. What our research shows, especially in health psychology and exercise psychology, is think about, if you can't do 30 minutes, can you do 1 minute or 30 seconds? Start low, progress slow, and do what you can. Everything adds up. And from a behavior change perspective, we can build our self-confidence when we do less exercise, feel like we can achieve it, and then we can build from there. Okay, so moving on to step 2 of our roadmap to becoming more active. This is all about the different exercise oncology resources that we have available in Alberta, across Canada. I know we're a coast-to-coast nationwide seminar today, so the resources I share really are focusing on what might be available to people across all of Canada. And then if there's any specific questions about some of the other ones during the question and answer, I'd be so happy to talk about it. And please feel free to stand up and move around as much as you need as we move into this part of the presentation. So as I introduced earlier in the presentation, we have an amazing lab of researchers, students, healthcare professionals who have devoted the last 30 years to developing, delivering, and evaluating exercise oncology programs. We have been doing them in person and online. When the COVID pandemic hit 5 years ago, we took everything we were doing to the online setting, and now we provide options for both in-person and remote access. And the big one I'm going to talk to you about today is our EXCEL study, which is our Exercise for Cancer to Enhance Living Well study. Maybe just quickly, is anyone already very familiar with EXCEL? Or is this maybe the first time? Okay, so mostly know that I'm seeing Kate. Excellent. So EXCEL is our main exercise oncology resource across Canada. It's funded by the CIHR Institute, our Canadian Cancer Society, and the Alberta Cancer Foundation. I'm going to walk you through all the components of EXCEL, starting with its key features, which there are 3 main components to EXCEL. 1, we have very comprehensive screening that occurs for every participant that is referred to our study. This is done by clinical exercise physiologists, where we look at people's health history, medical history, individual factors, and this allows us to ensure the safety of participants, to know who are they when they're coming into our study, and how can we best support them with our evidence-based resources? Second, we integrate programming into the community. And so with Excel, everything is done remotely, but we really focus on providing and creating programming that is supportive. So if you have someone who's participating in a smaller town somewhere in Ontario, we might have someone else in Manitoba. We really focus on that community integration and building that social support network within our programs. And really what we focus on is addressing the barriers and facilitators that people might experience in trying to participate in exercise. And thirdly, we have professional training for every single person that's involved in Excel in terms of delivery. So every exercise professional, every volunteer that works with our program is provided cancer-specific training to community-based exercise specialists. So we find people in the community who are keen to provide exercise for the cancer population, and then we give them specific training for exercise. Excel is open to any individual who lives outside of urban areas or centers across Canada, or where there are no exercise oncology programs. We've got other programs exist if you live in more urban areas, but Excel really is trying to address and provide access to those who don't live in those big cities or where you can't find exercise oncology programs. Excel is open to anyone who's pre, post, or within 3 years of cancer treatment completion. Typically people who can engage in mild to moderate intensity exercise, are over 18 and can consent in English or French. Excel referral takes place in one of two ways. Number one, if you have a healthcare provider who is promoting Excel to patients, they can either directly refer you to us, the study team, or they can give you a brochure or a poster. Or participants can be referred via word of mouth, a brochure or poster, a presentation like this one. Basically, you're referring yourself to the study, not necessarily linked to a healthcare provider. From there, once you are referred into the Excel program, we have screening and triage that takes place, again, like I said, by those clinical exercise physiologists who looks at your health history and wants to know, are you on treatment? Do you have a number of chronic conditions and health considerations for which that you would want to be supervised by a clinical exercise physiologist? Or people who typically are off treatment or are more in that recovery phase, who are still attending classes that are led by cancer and exercise specialists, but might not necessarily be led by a clinical exercise physiologist. Now, the difference between the two in terms of scope, a clinical exercise physiologist has the highest designation and training to prescribe exercise for any population. And in cancer, especially those who are undergoing treatment or who might have additional health conditions in addition to their cancer diagnosis, versus a community-based personal trainer or group fitness instructor still has the scope to deliver exercise in a safe manner. They have the cancer-specific training, but just their scope is a little lower, and it's not that gold standard that we have in Canada. And so they're not going to be testing and prescribing exercise for anyone living with and beyond a chronic condition. The screening includes, and triage is based on your tumor type. So prostate cancer, or if someone else that's participating in Excel, we include any tumor type. Your place on cancer continuum. So if you're pre-treatment, on treatment, or completed treatment, your treatment type. So your history, what have you had already for treatment? What are you undergoing, or what is your planned treatment? We know that exercise prescription differs a lot if you've had surgery versus chemo versus radiation, or a combination of treatments. And then individual factors. So your health history, your social support system that you have, medications that you might be on, your exercise preferences, your exercise history. We're taking basically everything that makes you you, in addition to that medical background, to better understand how can we support you to be more active. So we take that detailed report of everybody so that we can support them the best in the program. Then, once we've referred, screened, and triaged participants, we offer a 12-week exercise program. This program includes group sessions twice per week for 60 minutes. In addition to that, we offer 15-minute pre and post-class social. So all classes are open 15 minutes before and after the official workout, where you can come early, ask your instructor questions, connect with the other participants. And we found, especially when we started this during COVID, you don't always get that same connection when you're online versus in person. So the online pre to post 15 and it really allows us to facilitate some more connection among your fellow participants. The program includes multimodal delivery of aerobic strength and flexibility exercise that's delivered in a circuit style. So you typically do like 45 to 60 seconds of one exercise, move to the other, and repeat it a few times. Again, it's delivered online via Zoom. In addition to the actual exercise program, participants complete a few assessments before and after the program, and that gives us a good idea of where you're starting and then how the program may have impacted you. So we look at patient-reported outcomes. This is things like your symptom burden, your fatigue, your quality of life, your functional fitness. So we'll look at your muscular strength, endurance, balance, flexibility, aerobic fitness, and then also objective physical activity. So we're looking at your physical activity levels with a Garmin activity tracker across the 12 weeks as well to see how much people are moving across the intervention. A key component of our Excel program is that we deliver it in an exercise and educate framework where we integrate behavior change topics during class and via webinars. And what this does is it really allows us to support people's adherence to the program. And I'll share a few stats on that actually as well when we get to some of the findings of Excel. And again, it's led by qualified exercise professionals with cancer-specific training. Everybody receives a 15-hour online training plus in-person trainings. Like they are delivered very comprehensive trainings to be able to do this in the cancer-specific setting. The 12-week exercise program includes, like I said, that exercise and educate format where we are covering topics like how to support behavior change and behavior change specifically related to exercise, how to manage cancer-related fatigue, how to support long-term maintenance. So our programs are offered for 12 weeks, how to encourage people to see themselves as movers and continue exercising after that initial 12 weeks is over. Self-compassion, which we'll talk a little bit about today, but that self-kindness that you give to yourself, which is really important when working on behavior change or participating in exercise, and other health behaviors that might be relevant to the participants. And here's just one quote that I'll share with you from someone who shared their thoughts on the exercise and educate specific component of the program and the webinars. We offer these topics that are talked about during the classes and then as well with additional webinars. And people have said that it gives them the permission to focus on themselves. Giving themselves a structured formal moment in the week where they can really focus on something positive. And that was a really important part of their cancer journey. Sessions for Excel begin 3 times per year. We have intake that starts in the fall for September, winter in January, and spring in April. Once you complete that initial baseline or 12-week offering, we offer maintenance classes as well throughout the year that extend into the summer as well, in case people are interested in doing more than the 12 weeks. I'll talk a little bit about other resources beyond Excel, but first, just to share a little bit on the Excel numbers to date. We've had almost 1,600 people participate since we started Excel in fall of 2020, 488 of which have been in Calgary, 456 from our Halifax hub, 461 in Toronto, 86 in Vancouver and Montreal, and 99 people in Montreal. And what you see here, Excel really has a hub and spoke model where different regions of Canada are like the main base or the main hub or Excel kind of study point, but then still serve people in and around those areas, those who are living in those more remote or rural locations or where they don't have access to an exercise oncology program. And the beauty of this exercise and educate framework and the inclusion of behavior change topics is that we're supporting people's adherence to the 12-week program. And what you can see here at the very top here, the exercise intervention adherence has been really, really good overall. We saw those earlier statistics of how many people are actually active or engaging in movement across the cancer trajectory. This is how many people are actually completing and adhering to the 12-week program. So we can see that those are some really, really great numbers. The other ones here that you're seeing are completion of some of those measures, but really I wanted to show this slide just to show that people are participating in Excel. These are our first year implementation numbers to see how is this being implemented and how are people participating in the Excel program. One thing that I just love about Excel is that it's more than an exercise prescription. And this is what people tell us all the time is they sign up because they want to engage in more movement to improve their function and improve their quality of life. But it ends up being about community. It ends up being about regaining that sense of control and wellness in their lives. For healthcare providers, they have referred people into the program because they really believe in the power of movement and they see the impact on their patients well beyond the completion of treatment. Participants start to look forward to the classes, even on the days when they're not feeling well, and they really feel that sense of social support that they get from both participants and instructors that has been important in their recovery. And people feel that with Excel, they have gained a stronger commitment to their own well-being. And really, we know that when people are diagnosed with cancer, that sense of control is often taken away, and movement is one way to help regain that sense of control and feel like you can really prioritize wellness as a part of the cancer continuum. I'm going to share one video. So the words that are most impactful are always from our participants. This is just a 2-minute video that I'd love to share with you now. We tested it earlier, so hopefully the sound works, but this really just speaks to the impact that participants felt from participating in the Excel program. Just let me know if you don't hear it. Sound should start in about 5 seconds.
Like I can't get over in 3 months how much stronger I am.
I really noticed a difference in my strength, my endurance.
At first I thought it was just going to be a physical thing, that it would help me keep fit, but I found other benefits like certainly my balance and my flexibility.
I really think that the Excel program helped me to sort of manage a lot of the side effects that I was experiencing.
For my neuropathy and chemo brain and fatigue, it did help a lot.
As soon as I started exercise, my fatigue levels just started to drop.
I don't struggle to, get out of bed, stand up, tie my shoes, all kinds of daily stuff.
It just improves the quality of life too.
It's been life-changing for me.
Not only for physiological reasons, but for mental health reasons.
It really impacted my mental health too.
It's kind of nice that I can control my cancer journey.
Exercise has become one of those things to me that it is part of the cancer treatment puzzle.
I can't see me being without it.
And there you have it, the impact of Excel from the words of our participants. We've been running Excel for over 5 years now, or almost 5 years now, since 2020, and it's had a profound impact on almost 1,600 people across Canada. Now, if Excel doesn't seem like the right program for you, or you live, or you're just looking for something a little bit different, we've got a number of other resources that are available. Our Alberta Cancer Exercise Trial is for those who are living in Alberta in major urban areas. So if you happen to find yourself in a major city in Alberta, ACE is the exact same as Excel, just for those in urban areas. So same with the 12 weeks, same eligibility criteria. ACE is in person or online, and again, incorporates all those behavior change techniques that exercise and educate model. Another resource that's available to anyone who's living in Southern Alberta is the Prostate Cancer Centre Prehabilitation Program. We just opened this last March, and we've so far, we've been implementing prostate cancer prehab program for a year. And this is for anyone who's treated in Southern Alberta and who's going to be receiving a radical prostatectomy. So this may not apply to everyone, but if you happen to be in that region, this is an excellent program. Referral happens directly through your healthcare provider if you're scheduled to undergo surgery, or there's a consult, or you're going to consult for surgery. You're referred directly through our program from your urologist. People receive one-on-one and group-based support prior to surgery for up to 12 weeks, or however long you might be waiting for your surgery. There is additional pathways, including nutrition, sexual and psychosocial health, and exercise is one of them as well. And basically is developed to prepare people for surgery and support the recovery afterwards. More information you can find out about this from our team at the Wellness Lab or the Prostate Cancer Center directly. But this again is a brand new program, and we're hoping to expand it out over the next few years, not just to prostate cancer, but anyone with urological cancer. So this is an option as well if you're in Southern Alberta. Regardless of where you are in Canada, we also have Thrive Health Services, which is an organization, cancer wellness organization that trains health professionals and exercise professionals to deliver safe and effective exercise programming, but also has a number of free evidence-based resources for patients or thrivers, one of which is the Thriver Manual. It's a 90-page manual that was written in collaboration with doctors, researchers, exercise professionals, and it walks you through 10 chapters related to the evidence of exercise and cancer, nutrition and exercise, behavior change, how to advocate for yourself, how to connect with your healthcare team. It's basically a how-to guide for wellness across the cancer care continuum. We also have a number of exercise how-tos like infographics and information to help support behavior change. So that's an option online as well through Thrive Health Services. We also have our Health and Wellness Lab YouTube channel, which includes a number of videos, everything from 5-minute videos on specific exercises or stretches that you can do in the waiting room, or if you want to learn about certain types of exercises. So everything from that to full 12-week programs. So if you're maybe not ready for Excel, or it doesn't seem right for you, or you're in between our intake periods, we have a full 12-week exercise program available through our YouTube channel in both English and in Punjabi. So we're really starting to expand out, or trying to expand out, the languages that we're offering our programming in. We've got some researchers who are dedicated specifically to the South Asian community and filmed a whole 12-week series in Punjabi. We're also going to be starting an Excel Punjabi specific program, I think, in the fall. So if you happen to know someone or be in that area, stay tuned for Excel Punjabi starting in the fall. We also have a couple of videos in Cantonese, and we're hoping to expand out some of these YouTube videos in other languages. So if you have any other ideas, or you're perusing through our YouTube channel and think of things that would be really helpful to add, please reach out to us any point. We're always trying to expand what we have accessible online. Wellspring is another fantastic resource. Wellspring Canada, I have the Alberta logo here because that's where I'm based out of, but they have a number of locations across Canada with a number of wellness programs, including exercise. I have the exact dates here for Alberta, but different Wellspring sites across Canada would have different schedules. Here in Alberta, we have our exercise and educate model, which is the exact same thing as ACE and Excel, but it's delivered in a drop-in basis. So you don't register, you don't complete patient-reported outcomes the same way. You just register once, you drop in as much as you want, and we still follow that exercise and educate group-based circuit-style 60-minute workout. This is a schedule example of what we have available here in Alberta. And the beautiful thing about Wellspring is that it's free. It's available as a resource to anyone who's living with and beyond cancer, or who is a caregiver to someone living with and beyond cancer. And beyond exercise, there's yoga programs, there's Tai Chi. They have tons of movement and education programs that you can tap into as well. So if you haven't yet reached out to Wellspring, this is a great offering that they have available. Okay, so those are some of the resources that we have available: ACE, Excel, Thrive Health, our YouTube channel, and Wellspring. Now we're going to talk about understanding behavior change, some specific strategies for working with your potential barriers, facilitating movement. And if you need a couple seconds to reset, I encourage you to get up, do a couple sit to stands, because this next part is my favorite part, where we actually get to think about our own motivation and needs for movement. So when it comes to building your movement habit, we already talked about how we're trying to incorporate some exercise minutes every day, whether it's 1 minute or 5 minutes, just move more as much as you can. You are the expert, so listen to your body and what it needs. Sometimes we have more energized days. Sometimes we have more tired days. You're taking the guidelines, you're taking what you know about movement and tailoring it to your needs. Social support is huge when it comes to moving more. So research has shown us years after years that active lifestyles are easier to maintain when we have support from others. So asking family and friends to get active with you, joining an online group, program, or class. So like the many resources I just showed with Excel or ACE or our YouTube series or Wellspring, seeking social support can be really helpful. And then considering potential barriers. So we talked already about what you like to do, but also thinking about what's accessible to you. So do you live next to a community center or a park? Or is doing exercise at home more feasible to you? What do you have available in person versus online? And what is sustainable? Oftentimes in behavior change, we get excited to set goals, and we set these really big goals, which can be exciting. But sometimes those goals are set because we're pressured by society for what we think we should be doing or what's important to do, and may not always be sustainable. And the cool thing about goals is that we can revisit them often and change them as we need, but really thinking about what's meaningful to you. Common barriers to engaging in exercise are a lack of time, a lack of motivation or wanting to do it, a lack of social support, a lack of self-confidence or knowledge on exercise. And the number one most reported barrier from all of these is a lack of time. For a lot of people, it's competing priorities. We only have so many hours in the day and week when we're managing treatment or managing the diagnosis and managing the other things in our lives. It could be really hard to fit in a 30-minute workout, a 60-minute workout, even a 15-minute workout. But the good news is that there are a number of evidence-based strategies or behavior change strategies that you can think about to help overcome some of these barriers. And we're going to talk through a few common ones today, including goal setting, self-monitoring, barrier management, action planning, and social support. The first one is goal setting. And when thinking about your goals, behavior change, it's helpful to think about your motivations, opportunities for movement, the values it align with, and how you feel that behavior might enhance your well-being. MOVE, that's our acronym for this, is a MOVE goal. So this is where you can grab your pen and paper if you have it, or just reflect on it without writing down. Think about an a wellness behavior. Maybe it's exercise, maybe it's something else that resonates with you today, but some kind of activity behavior in your life. What is your motivation to engage in this behavior? So maybe this is to become more physically active. We can start broad. So adding more activity or maintaining physical activity. What is your motivation to engage in this behavior? Take a couple seconds, just think about it, write it down. What's your motivation to be more active or maintain your activity? And you can share it in the chat, or you can just think it to yourself. Your motivation, no right or wrong, just whatever was relevant to you. The second thing that can be helpful is thinking about what opportunities you have to engage in this behavior. So what opportunities do you have to become more active or to maintain your physical activity levels? So again, just thinking about it or writing it down. So maybe there's a specific time of day that works for you. Maybe there's a free class that's available to you. Maybe you have a friend who has a very similar goal as you. Then thinking about your goal or that movement or your desire to become more active, what core values of yours does that relate to? So at your core, why is this important to you? And if you find that, you know what, it actually doesn't really relate to my values, maybe it's a goal that is socially constructed or that I feel pressure from society to achieve, that's sometimes a good indication to revisit your goal. And the last one is, what will achieving this goal, or what will becoming more active or maintaining my activity, how will that enhance my physical, mental, emotional, or social well-being? So if I add more physical activity into my week or into my life, how will I become maybe happier? Or how will I improve my social connection? Will I become stronger? Really starting to think about those benefits that might be associated with the movement for you. beyond move. So move, you can kind of think of like a general framework to identify why something might be important to you. So really thinking about, again, your motivation, opportunities, the value of the movement for you. The beautiful thing about setting SMART goals, which you may have heard about before, is that we take that desire to become more active or to add more wellness into our routine, and we make it more specific, more detailed, and meaningful to you. And this is kind of a fun acronym, SMART, with 2 R's and 2 T's, because it allows us to take that goal. So let's say we want to become more active or maintain our activity. We make it way more specific. We find a way to measure it. We make sure that it's attainable, realistic, and relevant to us. We associate a timeline with it, and we seek social support. So specific relates to, what do you wish to accomplish exactly? Why and how are you going to do it? So I want to be more active. Well, do you want to walk more? Do you want to work more on strength versus aerobic? Do you want to work more on flexibility? Why? How are you going to do it? You take that goal, you make it as specific as you can. Then we know that we're more successful in achieving our goals when we can find a way to measure it. So how are you going to know when you achieve your goal? How will you know to measure your progress? How will you know if your goal actually is working or if you need to revisit it, change it, add, take away, finding a way to measure it? So maybe this is tracking, maybe this is taking time to reflect upon how things are going after a walk, but finding ways that you can measure. Attainable. So you want to choose goals that challenge you, but are within your reach. So, and this, sometimes I present this alongside realistic and relevant. You can kind of think of those as a package deal. You want to choose something, again, we've talked about things that are important to you, linked to your behavior and your lifestyle. So what works for you with your current situation, with your lifestyle, your needs, your values, and what's something that you can achieve. So if you've never done exercise if you've never done structured exercise, and you might think, oh my gosh, I want to start running. I want to run a marathon in the next 2 weeks. Maybe that's a great goal. Maybe you've got awesome fitness. But oftentimes it's more realistic to set something a little smaller and work towards that bigger goal. And it can be helpful to think about smaller goals or short-term goals and longer-term goals based on what timeline works or resonates best with you. And then the last one is thinking about how you can set a time frame for your goals. So are you doing something every day, weekly, monthly? Maybe you want to increase your activity and your social connection. Maybe twice a month you go for a walk with your best friend. So trying to find a way to add a time frame and thinking about the social support you might need to achieve it. And I know I said before that social support is directly linked to exercise behavior over time. Everybody's social support needs are different. So you might find that you gain better social support by actually being with someone and exercising with them. Maybe it's enough for you to call your friend and say, hey, I'm going for a walk. How about you? And just checking in that way. Maybe it's social support from a healthcare provider or an exercise professional, but finding what source of social support works best for you. I encourage you all now, let's take maybe 2 minutes here where you can think of an exercise goal you may have, or maybe it's not exercise, maybe it's wellness. And I want you to think about how you can make it specific, measurable, attainable, realistic and relevant, timely, and together. So I know we've reflected on our motivations, opportunities for it. I want you to take that goal, or I encourage you to take that goal and think about how you can make it more detailed and relevant to you. So here's an example of one. I will go for a walk with my partner 2 times per week in my neighborhood after dinner for 15 minutes to work on my aerobic fitness. I'm going to track our distance covered with my activity watch and note how I feel afterwards. This goal works really well for me as I currently walk once per week for 10 minutes, and I'm ready to increase my time. So we're making it specific because I'm going twice per week in my neighborhood after dinner for 15 minutes to work on my aerobic fitness. Very detailed, very specific. I'm going to go with my partner. So we're talking about that social support, that together piece. I'm going to track how I feel afterwards and use my watch because we're going to measure how I feel during it. And I can track my fitness progress with the watch. And it's relevant for me and it works well for me because I'm already walking and I'm ready to increase my time. So this is a goal that's meaningful, that's specific to this particular person. I'm going to give us 2 minutes so you can go and write down your SMART goal for yourself. I'm going to do one too, because we can all be each other's accountability buddies. And feel free, if you want to share in the chat, you can, or if you just want to keep to yourself, that's great too. But take your goal and make it specific. Okay, if you didn't have a chance to finish, that's okay. That can be your fun homework that you do afterwards. And in the spirit of accountability, I will share mine with all of you. I have a goal to work on my flexibility. When it comes to the guidelines, I have a really hard time adding in mobility and flexibility. And I was at a conference last week and we had the chance to do a yoga class with my friends, and I just felt so good afterwards. So because I have a goal to add more flexibility into my life, I'm going to go to yoga once per month to start. I'm going to start small, see how that feels with my girlfriends, do one class that will be 45 minutes, and see how I feel afterwards and progress from there. So that is my goal. You are all my accountability buddies, and we can share, I can share my progress with you maybe if we have a chance to meet again in the future. But that is what I'm going to be working on. In terms of other behavior change strategies, self-monitoring can be a really powerful tool to track your progress and see how things are working. So this includes review what is working and acknowledging what is not working. And that's an important part of your overall behavior change process. And it's helpful to set a time or a timeline for feedback and review. So putting it into your calendar, whatever works for you, to reflect upon how things are going. So this can come in a number of different forms. You could have an activity log or a journal, an activity tracker, or an app. I know one of you, Ross, you mentioned that you have an app. Maybe you track through that, having a tracking chart or a checklist. Or if that all feels like too much, just simply asking yourself after or before a workout, exercise makes me feel blank, more energized, less tired, more clear. A really powerful strategy that I love to incorporate into my classes is at the start of class, I always encourage people to take a second and think about what brought them to class that day. And I encourage them to think about 1 or 2 words that describe how they're feeling in that moment. And then I ask them again after class. And simply taking 10 seconds to describe how you feel in that moment is a great way to check in with how fitness is going. And maybe you set a goal that's too much for now. That's a great way to know to temper back. Or maybe you set a goal that you're ready to add to, so that taking the time to reflect and think can be really powerful. We already looked at this rating of perceived effort scale earlier. We've got our fatigue and energy thermometers, which are another type of visual analog scale that can allow us to reflect on our energy and fatigue levels before and after class. So that's an option as well. Action planning is another strategy that is used oftentimes in the behavior change world. If you think about goals often define a desired outcome. So maybe you're trying to increase your activity levels, change something in your fitness routine. An action plan outlines your specific approach or specific steps to achieve that goal. And it's a really important part in when we're starting to exercise and trying to maintain exercise over time. Scheduling is one example of a technique. So literally taking your pen and pencil, writing things down, thinking about when you can fit in your movement, how you're going to do it. And when it comes to the evidence behind action planning, we know that it enhances our confidence or our self-efficacy, and it encourages us to have a feedback and reward system built in. So it allows us to celebrate the wins and share that progress with ourselves and build that into the behavior change process. Here's an example of what it can look like. So we've already talked about the move goal and why that goal might be important to you, but action planning can include reflecting on that and then thinking about what barriers you might anticipate. So maybe right now, take a second to write down what are your common barriers that you've experienced with exercise, or maybe you have in the past, or maybe that you might anticipate to experience. We talked about lack of time. We talked about lack of opportunity. Weather can be a big barrier. Thinking about what might be an obstacle, and then what can you do to overcome those barriers? So let's say weather is a barrier. You know, you love to walk outside, you go outside and it's snowing, the ice walks are slippery. What can you do to still get your activity in that day? So thinking about the different facilitators or strategies to overcome the barriers. Another thing that can work for people is scheduling in the movement. So actually looking at your calendar saying, okay, Wednesday looks pretty open to me. I know that I feel the most energized before noon. I'm going to try to get in my 10-minute movement before noon after breakfast. And then Saturday looks open as well. I know I'm meeting my friend for coffee. I'm going to walk there if that's an option. So it's really about taking what your schedule looks like, penciling it in, and treating this appointment with yourself as you would any other appointment or medical appointment for movement and wellness for yourself. We know that social support, I've talked about this so many times, I'm coming back to it again, but it's a huge component of behavior change. And we know we're more likely when we can tap into social support. So again, thinking about what that looks like for you. If you're more of a person who likes to exercise on your own, that's fantastic. Think about how you can receive support in other forms, whether it's validation or just connecting with another person or setting goals together and then doing your movement on your own, whatever that looks like for you. Include others in your goal setting. Find an accountability buddy. And the last piece I'll share with you today on this behavior change process and the steps towards understanding your behavior change is remember that you're not alone. When it comes to setting goals, changing behavior, you're down here, right? Like you are the individual who is trying to change that behavior. To support you, we've got a number of other levels to support your behavior change. This is called our social ecological model of change that takes into account our policy environments, our built environments like parks and trails, our social norms, our culture around exercise, our physical activity domains, and the other people around our communities. Think about the different levels that exist in your life that support your movement. Social support comes in many forms across these different levels, and just know that for successful behavior change, it extends way beyond the individual. It extends beyond just you and your barriers and facilitators, but all the people, the policies, the structures that surround you that influence how you might engage in exercise. Self-compassion is another really great evidence-based tool that we talk a lot about in exercise oncology and just behavior change as a whole. And self-compassion is simply giving yourself the same kindness that you would give to others. And when it comes to behavior change and setting goals, we find that it's really easy for people to become to be harsh for ourselves and just remember that when we set goals and when we have intentions to become more active, it's okay if we need to change those goals. It's okay if you're not active one day. Give yourself that self-kindness to know, you know what, there's always tomorrow. I can try again. 20 minutes didn't feel right today. Let me try 2 minutes. Know that you're not alone. We're all trying to become more active and work on our wellness, and take time to sit with those feelings, those thoughts, and find the strategies that are going to work for you to become more active. Before we move on to our questions, before we move on to a summary, I encourage you, to take a second to think about one thing that maybe resonated with you from this talk. So either something that resonated with you from this talk, or maybe write down one thing that you'll do in the next week that can contribute to you being more active in your life. Write it down, say it out loud, tell a friend, call a friend later, but think of one thing that resonated or that you'll do over the next week to become a little bit more active. Overall, we know that exercise is a safe and effective resource for all individuals living with and beyond cancer, including prostate cancer. all movement is beneficial. Start where you can, start where you are, do what you can, build up from there. Many exercise oncology resources exist. Choose the one that works for you. And I'm happy to talk about other options during our Q&A as well. And explore the different strategies to understand your motivation. Maybe there's a few that really resonated with you. Maybe others don't feel like it's going to work as much. You know, trial things out, a little trial and error to figure out what works for you, because there is not a one size fits all approach. We have exercise guidelines, but a big takeaway message from a lot of our research is that we need to tailor it and individualize it to our unique needs, because that's when we can get the most benefits by actually adhering and engaging in exercise. And when people ask me, what is the best exercise to do? I always say the one that you're going to do, the one that you like, and the one that's accessible to you. Here are the list of resources. We went through all of them today. If you wanted to take a picture of this, or I'll pop them into the chat as well, if it's easy for people to just copy and paste them. I can put this slide up again when we're in the question and answer period. If you want to connect with us, the QR code here links to our website. You can connect with myself, Dr. Nicole Kulos-Reed, or for any of the resources that I shared to you today, if you just email us at Wellness Lab, we can direct you to appropriate resources. Even if you're not based in Calgary or in Alberta, we can connect you with resources, especially Excel, across all of Canada. Some references in case you're interested. And that is everything for my formal presentation. And I'm looking forward to chatting with you all and seeing what other questions or what questions you might have, and what other areas of information I might be able to support with.